Welcome to Stay Tuned with Intetics. Today, we're kicking off something we are really excited about, a brand new series with the brilliant minds inside Intetics who are actually moving the needle in healthcare on AI, on interoperability, on building digital systems that really matter. No theory, no fluff, just real talk from real people doing real job. And who better to open our very first episode as head of healthcare at Intetics? Please welcome Aleksey.
Hello, Irina, and thank you for inviting me to the series.
Thank you, Aleksey, for joining us. And guys, you're going to want to hear this one. So let's go. We'll discuss today how Intetics streamlined the denial processing for a major clinical network and helped scale the project from 5 pilot sites to 100 locations. Really, what is scale, right? And we also touch why denial management is becoming one of the most important topics in healthcare revenue cycle transformation. And Alexei, before we get to the project, could you please share your thoughts on why denial management is becoming such an important topic?
Yeah, thank you for the question. From our perspective, denial management directly affects lost payments and lost revenue. Even small improvements how denials are managed can bring real financial value. When an organization reduce time to handle process denials and they recover revenues, it's in other case they stay unpaid. At the same time, denial management is not easy process to fix. It requires deep process understanding and how the organization functions.
And what makes it such a complex problem?
Yeah, so to truly automate denial processing, you need visibility into multiple processes inside the organization, and it starts with documentation, clinical documentation, coding, note taking, diagnosis, and fair requirements and approval workflows. So if any parts of this chain is broken, then you might get the denial, and your claim will be failed. So that's why denial management projects require more than technology. They require understanding full operational system behind each claim.
That sounds really complex. And you need a really good partner, right? Knowing the
Oh, yeah.
processes and understand the challenges. But let's get back to the project. So, what was the challenge that the client was facing when the project started?
The organization was dealing with a high volume of denials and very manual process for handling. Each clinic has a slightly different process, and this means that teams were spending a lot of time on repetitive manual tasks without clear visibility why denials were happening. We began with 5 pilot sites and scaled up to 100 across the entire network.
And how did you approach solving the problem?
So first, we have 3 main priorities, and the first one was unifying the workflows across all locations. Second, introducing automation to handle repetitive and manual tasks like classification, coding, routing, and document processing. At third, we created data visibility for leadership. When organizations start seeing the patterns clearly, they were able to start preventing the denials, then dealing with each separate.
So the company were dealing with several business groups inside the clinics, and it required their intention as well. Yeah, great. And let's talk about the impact. So what kind of impact did it have on the operations?
Well, one of the biggest improvements was that approximately 20 to 25% reduction in denial, depending on the site, through improved data accuracy and automated validation. Automatic claim submission, denials, code analysis, and resubmission, automatic resubmission help to cut the time to submit and cost to collect. In addition, automation generated structured data and management team could analyze, and that helped to identify a recurring pattern that led to denials and allowed organization to prevent them. And as a result, instead of continuously fixing denied claims, and team shifted their focus on preventing them and before they occur, actually.
Mm, yeah, sounds interesting. And you mentioned, Alexei, that the project started with 5 pilot sites and then gradually scaled to 100. What really enabled that growth? So what made it happen?
Actually, this was one of the main challenges we had, and scalability was built to the design from the start. We created configurable workflows so that could be adapted to different sites and different locations. And we implemented the rollout mechanism that allows system to evolve as soon as more sites were joining. And so the approach helps the solution to grow from pilots into a network-wide operational platform.
Hmm. Yeah, really nice. And if to think of future, right? If to go a bit step ahead, where do you see this all going? What's the future? What the next steps? How it's going to be?
Denial management, yeah, denial management appeared to be a great foundation for AI solution. Actually, once the workflows and data structures were in place, organization was able to build AI agents. These agents can automatically analyze and ingest denial data, classify denial reasons, trigger appropriate workflows without manual triage. More advanced agents can even perform root cause analysis by linking denials to upstream issues like coding, authorization, eligibility, and recommend corrective, even execute corrective actions. So what began from just a denial optimization project turned into the starting point for intelligent revenue cycle operations.
That sounds really like a great opportunity for a clinic to move on. Great. Yeah, and hope AI will be a really great step forward on that project. So, Alexei, thank you a lot for this really great prompt diving into one of the latest cases. I see it as a very valuable insights. Hope, guys, those will be available for your teams as well. And if you want to get more on the case, or if you want to get more on how Alexei and his team approach the projects and how do they solve, so feel free to get in contact with Alexei or me. The contacts will be under this video. And thank you a lot for watching us and stay tuned with Intetics. Thank you, Alexei.
Thank you, Irina, and stay tuned with the text.
Stay tuned.